Daisy and Clare, thank you both for being here with us today. And it's great to have some GPs to talk to us just around the kind of health sides, the benefits of a plant-based diet. But for all of our viewers and listeners, could you just give us a little bit about your background and tell us what you kind of specialise in?
Well, so first of all, we are GPs, so we don't specialise. So we've done the kind of normal medical training, and then our specialty, if you like, is general practice. And we're both in that boat, even though we might have sort of dabbled with other things in more detail along the way. How we went into medicine is probably a bit different, isn't it? Because I used to be a civil servant, and I worked for the Treasury as a policy advisor, and then decided sort of as a mature adult that I wanted to go into medicine, that I was sort of always envious of people that were working maybe within the civil service who had a bit of a specialty, even if that specialty was tax or something like that. They were able to kind of use what they knew and solve a problem. And I thought, what am I interested in? Not tax, really. So I need to change things completely. So I went off to medical school when I was 35 and trained as a doctor, as a graduate student. So it was a shortened 4-year programme. And then at that time, I probably would have thought that I would have gone down the hospital route, and I did for a little while. And then I went into general practice.
Yeah. Whereas I was, 18, straight into medical school. I always knew I wanted to be a doctor. I don't know where that came from, but it was just sort of wanted to help people, was interested in science. And so I went to medical school at the age of 18 and just had a really traditional sort of career. We have to do hospital jobs first as part of GP training. And then after sort of 3 or 4 years, you decide if you want to be a specialist or, as Claire says, a generalist. So I've been a GP since 2005, I think. Yeah, 2005. And now we've obviously both got an interest in nutritional education and particularly plant-based nutrition. So we've both done extra qualifications in that. We've both done the plant-based nutrition course with the University of Winchester. Yeah. And we're both plant-based health professionals as well. So we're about to be qualified in lifestyle medicine. That's the next thing. So we do additional training after sort of core medical training. But that's been our professional career journeys, I suppose.
That's amazing. And in terms of the kind of general practice as well, I know that you're kind of interested in holistic, kind of that kind of side of things as well. How do you sort of see them as crossing over?
Yeah, very much so. I think it's really important to see our patients as a whole, so not just as a disease, for example. And when we talk about holistic practice, that's exactly what it means. It's looking at people's lifestyles, people's diets, exercise, activity, stress, their sleep, their social connections. Because we know that all these things play a role in disease progression or disease management. And so, and health promotion, really, preventative medicine. So we're both really interested in that.
And there's some kind of, I think the fact is, isn't it, when they talk about how much of disease is related to lifestyle, which includes diet, it's about 80%. So that's where you really should be focusing. But we're probably not at the moment in the NHS.
Is that resources or just a kind of the general way of being?
I think it's the way you think about things, isn't it? You sort of think that in order to go to the doctor, you need to give them a problem that they need to solve, and that for a patient is very much focused on a symptom. A lot of the symptoms that you get from something like poor diet, you don't feel the effects in a way that you necessarily connect. You might go and see the doctor because you've got what we would see as symptoms of poor diet. So we do see patients that have got like acid reflux, constipation, laughing, I knew that would come up. But people don't generally come in feeling unhealthy because they're slim and maybe they've been doing something like the keto diet, they're able to run a marathon, but underlying that might be some quite bad sort of coronary artery disease.
Mm. I mean, you were going to ask, weren't you, Rachel, earlier on a little bit about some of the fad diets?
Yeah.
Do you want to ask about
Yeah, I was just going to sort of see your opinion on diets, sort of like keto, intermittent fasting. Is there anything that you think, you would advise your patients never to do? Are there benefits to doing these kind of diets in your opinion?
Well, I mean, keto's funny because it came up only yesterday. I was seeing a patient and she had a cholesterol of 11. Now, I don't know if people know what the normal cholesterol scale is, but we aim to sort of keep it below about 5. So 11 is pretty high. And she was slim, she did exercise. She'd been off to a sort of special sort of fats clinic to see what she could do. She'd been offered a medication called a statin, which is specifically aimed at lowering cholesterol. And she wanted to have sort of a big discussion about her. She'd had some more specialised cholesterol tests and she wanted to look at the different, it was actually beyond what I would know as a GP, to be honest. She then did say, I sort of said to her, look, it may not be all of the problem, but some of the problem, if you really don't want to take medication, you can look at your diet. And cholesterol is only in animal products. It's only in meat, fish, dairy, eggs. It's not in plants. So if you've got a diet that's heavy in animal products, if you reduce that, you can actually, maybe make about 25% difference to your cholesterol. And sort of her reaction then was, I don't think I could tell my partner that I was becoming vegetarian. So there's a lot of resistance to that. But then she said, well, I did do the keto diet and I lost loads of weight. And I thought, ooh, how recently was that? Because what we know is the keto diet actually causes cholesterol levels to go up. And that's because it's very high in, if you're doing it on an animal product-based basis, it's going to be high in the kind of fats and foods that are going to make your liver make more cholesterol. So I'm not keen on the keto diet. There are plant-based versions of the keto diet, but I think the one that I would say I would be most wary of would be the meat-based one, and sort of going back to the 80s or 90s where there was something called the Atkins diet, which was, people love it because there's an example of someone who harps back to that when they did that diet, and that's when they felt great because they were slim and they probably felt better because they'd lost weight. But what was going on inside their body, in their liver, in terms of non-alcoholic fatty liver disease or in terms of their arteries would be something quite different.
And their gut microbiome. I mean, we're learning more about that now and how important whole foods are, whole grains and nuts, seeds, fruits, vegetables. So, I think the scientific consensus is very much across the board that the healthiest, healthful diet is a whole food, plant-based diet. There's no doubt about that. We had a big, the Eat Lancet report was commissioned to look at what would be the healthiest diet, both for human health and planetary health. And, there was about 37 different specialist scientists and professionals over 16 different countries looking at what would be the best diet for human and planetary health. And it comes back to whole foods, so your fruits, vegetables, plant-based, nuts and seeds, legumes, and only a really small proportion of your plate, the sort of Eatwell plate that we talk about, needs to be protein, a quarter. And the report does state preferably plant protein. There is a caveat that if you want to continue eating animal products, you can, but the report definitely states it's not necessary for health. And they do recommend limiting those animal products if you are going to eat them. So I think in answer to your question, we don't really recommend fad diets. We recommend sticking to a whole food plant-based diet where you can.
And something that you can do long term as well, which, all of these things like time restricted eating, people like them because they lose weight, but whether they can do that culturally and socially for the rest of their lives is a much bigger challenge. And I think I'm maybe not up to date on the science of it, but the time restricted eating, much like the low carb diet, it's thought to increase your long-term risk of cardiovascular disease. And what that's to do with, I don't think we really understand, but it'll be to do with some kind of stresses that you're causing on the body through doing that.
I think there's no harm in maybe shortening an eating window. I think some people do. There's science there that can be helpful in terms of insulin resistance and weight management. But, you perhaps have a later breakfast or an earlier dinner. I think there's absolutely enough evidence to suggest we shouldn't be eating late at night and snacking after dinner, for example. And I think that's really what we would see as time-restricted eating rather than sort of fasting for 48 hours or whatever sort of fad is talked about.
It's a funny one, isn't it? Because you kind of you lean into your own body as well and you sort of learn what works best for you. For me, for example, I can't eat a huge meal in one sitting. Mm-hmm. I'm a grazer. Mm-hmm. So I'll start quite early on and that will do me throughout the day, and that kind of works for me really well. One of the things I was going to ask you about as well is around Ozempic and things like this, because, again, with the fad diets, it seems that there's almost a bit more of an extremist kind of approach to things at the moment, and we don't really know the long-term effects, like you were saying then again, with the liver problems and what that means for people. And yeah, again, with the intermittent fasting, it's fine in short sort of space of time, but long-term, we don't really know the effects of this. Is that something that you know much about, or?
So I think our encounter with Ozempic is that obviously it came out specifically for use with people who've got diabetes, and it had good results with the diabetes, and of course it was found to help people to lose weight. And it's really a later thing that it became very popular with weight loss clinics. And interestingly, obviously our own guidelines, NICE guidelines, say that it can be prescribed for weight loss in some limited cases. So you have to be quite big. You have to have another health condition, like you need to be suffering from something else, whether that's diabetes, hypertension, high cholesterol. But how I feel about it is I'm not sure where we're going with it, because as soon as you stop taking it, the effects don't last. And it does seem that would be something to do with, it's a very nice story to tell that I'm going to take this drug for a year, and in that year I'm going to learn to be healthy, because in that time my cravings will reduce, because they do, because the side effects of it are, of course, feeling, perhaps full to the point where you might feel a bit sick. So people do lose weight with it. But then what's not been borne out with any of those weight loss drugs in the longer term, whether it's the Ozempic, semaglutide, or Wegovy, or Mounjaro, is that you actually keep that weight off. So you stop taking it, and within a year, you've gained something like 95% of the weight back, or within 2 years you have. And it's really expensive. And we don't know the long-term effects, on the liver or other systems in the body. So it feels like when you know that a whole food plant-based diet is very difficult to be overweight on that diet, it feels like a real shame that we're having to resort to that. But on the other side of it, people would say, well, even, 2 years being the right weight could be beneficial for your health. And if you can't do it any other way, they've obviously evaluated that in terms of the NICE guidance and said, so we'll get something from this. So there are lots of clinicians equally in the plant-based community who would be excited by that. But I don't know if you've got anything to add to that, Daisy.
I mean, we've spoken to an obesity specialist on our own podcast, and it's a really interesting episode, actually, if your listeners want to know more about Ozempic. And I think what I found really interesting about that episode was what Sue said about her patients who she does prescribe Ozempic for, but they also have the opportunity to see a psychologist. Because I think once you get to a certain level of obesity, there is much more to food than just overeating and why are you eating the wrong things, and actually looking at working with somebody from a psychological point of view just to see how that can be helpful. So I think there is definitely a place for things like that, and there are specialist clinics that we refer to as GPs if we think someone will benefit, but it's often done as, again, like you mentioned, a more holistic approach. So that's my...
So we're not doing it at the moment because we've run out. So it's prioritised for diabetes at the moment. So kind of the more you get the message out there that you're going to be disappointed if you go to your GP at the moment expecting to be referred for that. I think that's the line we have to take on that at the moment.
Well, it's the people with the need because of the diabetes, and it's the people who are using it, they might have a need for themselves, of course, but it's different, I suppose. I was going to ask as well, so Daisy and Claire, you've both obviously very plant-based. Can you tell us a little bit about your vegan journeys and how that kind of started for you, individually?
Yeah, sure. Do you want to go first?
I'd go first on this.
Sorry, very polite. It's going to be a long story. Actually, it's not going to be a long story because I came to veganism quite late, actually. I was 40, so I wish, like most vegans, I wish I'd gone sooner. So I didn't really think very much about my food growing up. Although when we've spoken about this before, Claire, I did remember, do you remember I told you that story? When I was about 6 or 7, I remember having a piece of chicken on my plate and suddenly making that connection that it was an animal. And I remember saying to my mum, I don't want to eat this. It was on a bone. I think that's really what made me think about it. And she said, no, you have to eat it. You won't grow if you don't eat meat. You've got to eat it. And so I was sort of forced into eating, and I was a bit of a people pleaser. I wanted to please my parents. So I ate it, and I didn't really think then after that very much about my food or where it was coming from. And then I watched a documentary called The Game Changer. Yeah, I'm sure your listeners have heard of it. And I just thought it was really fascinating that professional athletes were eating plant-based, and they're helping with their health and their exercise recovery. And I'm by no means a professional athlete, but I thought this is really interesting, and it sparked that curiosity in me about nutrition, which I'd never really thought about before. And so I said to my husband, just really, on the off chance, I said, should we try it for a couple of weeks to see how we feel? So overnight, we just switched to plant-based, and we were both, omnivores before that. We probably had meat in almost every meal. So we did it for 2 weeks, and we both loved it. We both felt brilliant. We slept better. We had so much energy. We were exercising better, recovering from exercise. And in those 2 weeks, I was doing a bit of research, being, already a health professional. I thought, should I check and see if this is okay to do? Is it okay to feed my child this way, etc.? And I started uncovering more and more evidence that actually not only is it okay, it's beneficial for your health, and the literature was overwhelming. And I said to my husband at the end of 2 weeks, I said, I'm going to continue. I'm loving this. And he said, oh, yeah, I will as well. So we just continued. And then I was doing medical research, but I was also doing research on the ethical considerations and the environmental considerations. And that's when I sort of made that click between the animals again and what was on my plate. And, I went to slaughterhouse vigils. I watched a lot of documentaries, and I just, it was like the blinkers had been removed. And I thought, gosh, how had I not seen this for 40 years of my life? And I'm now vegan for ethical reasons, but, really passionate about the fact that a plant-based diet is so good for human and planetary health. That's, I've decided both me and Claire, we decided to launch our own podcast after we joined the plant-based health professionals, and we're advocating for plant-based nutritional education for both healthcare professionals and for the general public alike. And so, I'm really pleased now that all my family are vegan, my immediate family anyway, and my teenage son, which is great.
That's really impressive to get a teenage son involved, isn't it? Let's be honest.
So that's my journey.
My dog is vegan.
Wow.
Well, they always say they're not vegan, are they? They're plant-based, because she's not making any conscious choices there. Yeah. So I love it when people say, my only regret about, going vegan was not doing it sooner, because my story is a bit different, and it's a story of shame, because I used to be vegan from about the age of 16, and I was definitely the only vegan I knew at that time, and I'd been vegetarian for a long time before that, so I didn't sort of do it overnight, but I still found it really, really difficult, and I found that I was relying, I wouldn't have found the health benefits at that time, because I found that I was really relying on a lot of things like processed cereal, soya milk, beans on toast, and it felt like I was, really cutting myself off from other people. I certainly didn't think I was taking a healthy choice, and I wasn't absolutely sure, because I didn't, unlike Daisy, who's been to vigils and things like that, I've never been near a slaughterhouse. I couldn't bear to. But just the thought of it was enough to sort of push me in that direction. It's sort of like I did that then for a few years. I wasn't this healthy, slim vegan. I was a little bit overweight. And then I moved to Germany, and I just found that it was, nigh on impossible to really stick to it. And I was living with a family. And so I started eating other things, like some eggs sometimes, some dairy if I couldn't get soya milk. And then I came back to England. I was vegan again. It all seemed to be sort of going in the right direction. And then for reasons that I can't really explain, because it certainly wasn't a health report or something, I started eating fish. So I had this, this non-dairy, no meat, but fish diet. And I think it was really just to integrate me a bit in social situations. And then I eventually got to the point where I was like, I'm not going to really tell anybody I'm vegan, but I am. But I'm not really going to make a big deal of this. And I said things like, I would say things like, I think I'm intolerant of dairy and that's why I don't have that. So I was always making excuses for the bit different things. And it was only when I noticed in about sort of 2015 that the whole world seemed to have gone vegan. I know they haven't, but it felt like there was this explosion of veganism that I was like, oh, I can come out now. So then I was like, yes, I'm actually vegan, and gave a name to it. And then it kind of all rolled on from there in terms of finding out about the health benefits and things. So it was really wonderful, everything coming together.
That's great. I mean, in terms of, as well as kind of the education piece around healthcare professionals and teaching them about the plant, benefits of the plant-based diet, have they been more receptive in recent years, or is this something where the conversation's been open for a while, or have you seen a shift? Both of you really.
Well, you're going to say yes, aren't you?
Yeah,
so
you
go for it.
We've had this conversation
positivity
about whether we have or haven't, and I really do think so. I mean, we've seen an explosion already in the supermarkets and in restaurants and in what seems to be in general society. But I also think amongst healthcare professionals as well. I think, when we were in medical school, the medical curriculum didn't really cover nutrition very much. For example, I didn't get many hours of nutritional education, and that's changing already. There's now lifestyle education within the medical curriculum. We've got doctors now talking about preventative medicine. And I think, people are interested, whether that's from a human health point of view or from the planetary health. We've got doctors now talking about sustainability and, how we can, the environmental impacts of what we eat, for example. So I really do think there is a shift. And it's not as quick as we want, perhaps, but it feels like there is.
I think there are some people doing it very, very well. And as you say, there are these, there are doctors that are doing the whole climate change plus, all the implications for sustainable food, which is obviously taking you naturally towards whole food diets. But one of the big barriers that you'll find with any general practitioner, for example, is that people will say, with everything else that I've got to do, I don't have time to talk to people about diet. And that is your biggest barrier, because you've then got this, that's the first barrier you have. And then you've got, if people actually have got time to talk about this, are they going to say the right things? Because they haven't had maybe the education that we've looked for. And so we work quite hard at sort of talking to colleagues in as positive way as possible. That might be changing the way that you do a kind of meeting lunch or something like that, where you're actually really trying to say, look, get with 2024, we shouldn't be serving red meat, we shouldn't be. Because when you look around the NHS, you would be forgiven for being confused, because processed meat is everywhere. It's in hospitals, it's being served to patients, it's being served to staff. That is how it is. So I think to actually sort of say, yes, it is a really good thing having this diet, and lots of other health professionals would agree with me. Sometimes it's a bit like people are looking at you like, really? And that's the challenge. And when people sort of say, if it's so great, why aren't there more vegan doctors, or why aren't there more plant-based doctors? I would say the same for every other health problem. I would say, why does your doctor drink alcohol? Yeah. Why do you find doctors who smoke? Why is your doctor fat? There are really complex cultural reasons for why people don't do the healthiest thing, and doctors are no more likely to switch than anybody else. So I think the rate at which people change, we can't necessarily expect it to be faster among healthcare professionals than amongst the general public.
Yeah. But, day to day, what we see, in general practice, as Claire mentioned, is a lot of chronic disease. So things like cardiovascular disease, heart disease, and that's driven through things like high blood pressure or high cholesterol. And when you look at the data on a plant-based diet, all I need to tell my colleagues is it's a good sell. It really, the common things you're seeing day to day, you could reduce the risk of, say, cardiovascular disease by 25% on a whole food plant-based diet. High blood pressure, 60% reduction. These numbers are huge when you add it up, and you think this is the day-to-day work of a GP. and how much that could change if we did a shift towards a whole food plant-based diet. And so when you have those sorts of conversations with your colleagues, hopefully that will spark an interest.
They tend to agree with you, but in the same way that they'd agree that, alcohol's not a good thing or smoking's not a good thing. But it's just getting health messages across is so much more powerful when you've got somebody who's walking the walk and, not just talking the talk. So that's why it's really important that we've got doctors like ourselves who are being very open about the fact that we follow plant-based eating. I think that's much more empowering in your message than if you sort of are just giving somebody the advice and saying you could reduce your risk of diabetes, actually sort of saying, and look at me, look how healthy I look. And it's a bit of a pressure, isn't it, Daisy?
Yeah, no pressure. It's funny though, because even 15 years ago it was now, I remember telling a doctor, we were doing some blood tests, I was fainting, and they suggested that I started to eat oily fish again because of the, the B12 kind of aspects of things and the omega-3 and things like this. And it's funny because you reverse that, and 15 years later, just for a general kind of checkup, I was like, oh, I'm vegan, to my doctor. And she was like, oh, that's fine, me too, and she, she's like, everything, don't worry, we'll check it all out. And
yeah, I was really apprehensive to tell my GP that I was vegan because I went in to have some routine blood work done. And I was really scared. And I was like, I'm vegan, but I'm a healthy vegan. I don't know why I felt the need to justify it. And the doctor was like, yeah, that's fine. I did all the blood tests and everything came back completely fine. And he's like, it's okay, you don't need to worry about it. But just, I guess it's the psychological thing of thinking that he might have turned around and said, what do you mean? You need to be having meat and fish. And there's nothing, I don't know why I thought that. Just,
well, it's
a psychological thing.
It is that kind of, that it's no different for me when I think about me when I first was working as a doctor. I felt like if I was to talk about a plant-based diet, it would be tantamount to talking about religion or politics. And it's so great that it's not like that at all now. But at the time, I would be like, well, I don't want to, there's all this, if somebody's got irritable bowel and they were doing the FODMAP diet and it was sort of saying, avoid beans and things like that. And I'd be thinking, I can't say anything about plant-based diets because I might make somebody ill because they might not do it in the right way. And that sort of accountability that you feel you have to have for the plant-based diet, which other diets don't have that level of accountability. Nobody really challenges somebody who's eating a very kind of, 2,500 of calories of the wrong food, processed food. That's the normal standard diet. So, but we've almost got to have a better than normal diet when we're doing it plant-based.
It does help a lot now, I think, that there is a lot more information, like the report you were talking about, and you've got people like Dr. Joseph Poole, and you've got all these experts in their fields who, it's just taken a bit of time, I think, for that kind of research to be readily available. So, even the NHS website, it wasn't long ago when the kind of healthy plate didn't necessarily include the plant-based diet, did it? It was, yes, legumes and vegetables, but they also had fish and cheese and meat on there.
Yeah.
Still there.
It's still there.
So the science isn't new. The science has been there a long time.
The Eatwell plate is from 2017. So, we will be there lobbying when it gets updated. I'm not sure when that's going to be, but even that is a little bit out of date.
Interesting.
Can we talk a little bit about ultra processed foods, which I just feel like I can't read the news without there being a story about how vegan burgers are the worst thing you could ever possibly eat, and it's actually now fine to eat red meat. And it's sort of something that I've experienced as a vegan. I've had people say to me stuff like, oh, you're not eating that Beyond Burger, are you? Do you know that all the ingredients are in that? That's ultra processed, while they're eating red meat in front of me. And it does seem sort of a bit of a contradiction. So I guess I just wanted to know what's your opinion on ultra processed foods that are vegan? Would you say completely avoid? Would you say in moderation? What's sort of your...
I think context is really important here, and it's always instead of what. And so, spoiler alert is that, where we've had this sort of swap meat study, and it's come out and said that, even what would be considered to be one of the most ultra processed alternative meat burgers, I think it's the Beyond Burger, isn't it, is still better than the best red meat burger, the grass-fed beef and everything. So in that context, I would never let somebody sort of have that argument that, red meat is somehow better than an alternative to, a vegan alternative. But it's all about how these foods have been classified. And so if you sort of look a little bit into the fact that there's one classification system called the NOVA classification system that has dominated, and that has put milk and red meat in category 1, which is the least processed, and it has put the Beyond Burger in category 4, which is the most processed. This doesn't look at the healthfulness of the food. So we don't know within that category 4, within those ultra-processed foods, which ones have got, health problems and which ones are actually probably quite healthy for you. Oat milk is also in category 4. Soy milk, it's almost written against the plant-based food industry in a way. But it is just there based on things like factory criteria. If your whole grain bread is made in a factory, it's automatically in category 4, regardless of the ingredients list, as far as I know. And if it's made in a more artisan way with the same flour, it'll be in category 3. So there's a lot of, there's a lot of misleading kind of ideas around that. So I think we're sitting back because the ultra-processed food studies have, of course, shown that association between ultra-processed food and increased rates of things like diabetes and cardiovascular disease. But because they're based on people who have a high intake of anything that was in that category 4, that doesn't really take out how somebody following a plant-based diet would have done. And when it comes to, something like red meat being in category 1, well, we know it's we know that red meat is a class 2 carcinogen, so it's also probably causes cancer. Then that's something we already know we should avoid. So without going into, how processed something is.
Yeah. It's a lot more nuanced, isn't it, than just those 4 categories. And I think that's the issue. I mean, your question about oat milk, for example, was a really good one because you see people talking about that all the time at the moment. And, plant-based milks in general, can be a spectrum of different things. So you've got, soya milk has got a lot more protein than, say, oat milk. So try and class everything in one category and without looking at the overall nutritional profile of the whole end product and putting it in the context of the overall diet, for example, is limiting in that respect. And, I think the issue with milk and dairy is so huge anyway, and the problems associated with dairy, both in terms of health and environmental aspects of it, that actually, we both feel very strongly, happily that we all drink soya milk and, and I think if your listeners have got a real issue with the processing of some plant-based milks, there are the organic ones which don't have any, additional ingredients other than, say, the soya bean in the water or the oat in the water. So there are options for people. I think sometimes these narratives are fed in to discredit.
Of course, we strongly feel that.
You've got to follow it as well on factoring things like affordability. Processing food can be really useful, and where you're talking about, coming back to that Eatwell guide, and when you look at the fact that less than 1% of the population are eating according to the Eatwell guide, which is the sort of minimum healthy, diet guidance, they're not probably, you're probably going to get even less if you try and look at avoiding things like processed food, because processed foods are often cheaper, they're done efficiently, they don't waste nutrients. So I don't think we're there in terms of what food is being supplied to the average person to be as picky as saying, just make sure you don't have any kind of ultra-processed food.
Yeah, I think it is a lot more nuanced. And I think, as plant-based health professionals, we would promote whole food plant-based. Yeah. We know that actually if you eat the vegetables, the fruits, the whole grains, these are the most healthful foods for you. But if you are adding a little bit of processed foods in there, and as I say, the nuance is important. So plant-based milk is very different from, say, a pink packaged donut that's very high in saturated fat, sugar and salt. They're 2 completely different things, but they're in the same NOVA category, as is formula milk, for example, which we feed our babies. So, we have to think about it with a bit more subjectivity, I think.
Makes sense. I was going to ask as well, because obviously you see a lot of patients, and have there ever been any cases for either of you where you've kind of recommended a plant-based diet, to help improve somebody's health conditions? And have you seen any of changes, positive changes as a result of that?
Yes, I mean, I think we're not the people to ask for beautiful case studies, because I think the context in which we work is we'll have a succession of what's essentially a 10-minute, you usually stretch that 10 minutes, but appointments with someone, and you've got to give them, it's not enough to just download the information, you've got to find a context to put that into. So in each consultation, you might only find out one thing about a person's diet and then suggest a positive change on that. So certainly, one of my favourite questions is to ask people what they have for breakfast. And often they'll give me a whole variety of things. And, I had somebody the other day who was sort of like, sometimes I have toast, sometimes I'll have cereal, sometimes I'll have a cooked breakfast. And you get all this, and then you sort of, you're picking, you've got to pick out something. What am I going to say to this person about their diet? And, they're constipated. What am I going to say about their breakfast to help them with that? And they'll usually say something like, I have children, almost like that's a reason for me having an even more unhealthy diet. But then I'll say, well, then you should especially listen to this advice. And I'll maybe just give them the advice, say, about having overnight oats for breakfast. Or I'll say, look, if you haven't got everything in the house to do that, and I'm going to mention a processed food, I will say just have 2 Weetabix. And then maybe if I'm feeling really daring, I'll say with soya milk, and I'll say something about why soya milk is good, appropriate for, if it's a man, reduce the risk of prostate cancer. If it's a woman, help with your menopausal symptoms. I'll throw it in there. And then it's really beautiful if you've got somebody who's got something very measurable, like a cholesterol level. And then you'll take that person I had a teacher who was overweight. He wasn't eating breakfast. He thought not having breakfast was the only thing saving him from getting even bigger. So he was clinging on to that as a practice. And I said, do your overnight oats. If you haven't got time to eat in the morning, take them to work. And he did that, and it completely changed the way that he was eating, because he was, not eating then so late at night. He was knowing that he was going to be hungry to have that breakfast. It was really healthy. It was low in cholesterol. And he lost about 8 kilos. And then I said, let's do your cholesterol. And it had come down from 7 down to 5. So I was super happy with that.
Yeah. A big jump, isn't it, as well?
Mm. Oh, it's possible on a plant-based diet. Absolutely. Yeah. I'm feeling a lot more confident with talking to patients about it, to be honest, because the more I read the literature, the more I see the scientific evidence, I think I owe it to my patients to tell them about it. I think we do a disservice if we don't speak about lifestyle measures now. I think the evidence is too compelling to ignore.
It's brilliant. And it has, the fact that you're sitting here today saying that is so different from even 10 years ago. It has changed really rapidly, like you were saying, sort of 2015 when everyone came out the woodwork and suddenly vegan, rainbows everywhere. But now there's been huge changes. I was going to ask as well a little bit about the podcast, which is great because it gives you an even bigger platform, really, doesn't it, than your 10 minutes in a surgery. What was the kind of idea behind that, and how did you kind of come up? How did you both decide to work together on this?
Well, we met, about 18 months ago? So not even that long ago.
No, it was April last year.
Oh, okay. Yeah. So we were both members of the plant-based health professionals for some time. We still are, obviously, yeah. And, we'd been sort of in our own GP practices separately. We don't work together day to day, talking to our fellow colleagues, to our patients, perhaps giving talks to small groups, to our nursing colleagues, etc., about whole food plant-based diet. And we really wanted to just widen that, because having these small conversations was great, but actually how could we reach more people? So when we met, we were talking about whether we could go to, say, bigger talks and do more.
Be efficient, have a standard way of teaching things. We were throwing out the ideas.
And I love podcasts. I listen to podcasts sort of all the time.
She does.
So I said, why don't we do
Are you listening to one now?
Why don't we do a podcast, Claire? And we're really lucky in that the founder of Plant-Based Health Professionals, so I'm sure you know Shireen Kassam, who's a consultant haematologist in NHS. She was very supportive of our idea, really happy for us to give it a go. And we invite guests. So we have sort of consultants or nutritionists or dietitians or specialists in their fields who come to talk to us about their particular topic. And so, yeah, we've had really fascinating episodes and discussions with these people, haven't we, Claire? And hopefully bringing that sort of education not just to healthcare professionals, but to the public as well.
And that's one way that you can save a lot of time in your consultation. So if you have somebody who, say, comes in and they've got polycystic ovarian syndrome or they're going through the menopause, the chances are that we might have done a podcast on it. And then you can say, look, you know, sometimes I don't even tell them it's me on asking the questions, but I will direct them to a particular episode. And that gives them so much more than you can cover in the 10-minute consultation where they probably wanted to talk about something other than diet.
Yeah. And I think our aim started, didn't it, as trying to educate other healthcare professionals, because we thought that would hopefully increase the pool of healthcare professionals.
Of people walking the walk.
Yeah. But now I think it's also quite relevant to the general public as well, isn't it? Because we were talking about this the other day. We really want the next generation of vegans to be as healthy as possible, to take their B12, to make sure they're doing it the right way, to, you know, so that actually when the studies come out about us, that we are a healthy bunch.
Yeah, because like talking about myself, I took part in, I think it was called, you know, the big health study that's going on at the moment where they, you know, everybody sort of got sent a barcode or something to go and get a blood pressure check, cholesterol check. And it asks you loads of lifestyle questions. And I went and got my cholesterol checked, and of course it was like 3.5.
She's showing off now.
Yeah, not to brag.
Yeah. But, you know, the evidence is there. And it was funny because they didn't ask me anything about really what I ate. And I was so disappointed because I thought I was doing this so that I could feed into some big study and people would go, oh, yes, you know, plant-based diet is quite healthy. But anyway, it's out. We're going to make sure that no vegan is ever without B12, aren't we? Going forwards.
No, that's great. And in terms of that as well, especially while, you know, we're filming this now, for people who are curious about omegas, about B12, about their protein, you know, the typical FAQs that people come back with, are there any kind of hardline things that vegans should, supplements that we all should be taking?
B12.
Yes.
Yeah. And whether you do that as a daily dose or a weekly dose, but just be aware that there's a massive difference in the dosing. So it's about 10 micrograms a day. But then if you're looking at a pill and it says 2,000 micrograms, that's your weekly dose, which is counterintuitive. But you really, if you're taking it in one go, you're going to have more trouble absorbing a larger amount. So you have to take a large amount. I tell everybody to take vitamin D almost without exception, and that's nothing to do with being vegan. That's just living in the UK, having jobs that are mostly inside. And why risk it? You know, it's a really easy thing to take. And then omega-3s, I think we're not sure, but we do say that, you know, people who might have greater nutritional need, so that's, you know, people that are elderly and we're not quite sure how they're processing the short chain omega-3s, the ALA from flaxseed and chia to make the longer chain ones, so the DHA and the EPA, those people, so elderly, pregnant, even children, you might want to think about one of these microalgae supplements because they're better than fish in that you don't have the toxins, they're sustainable, so you're not harming the environment, but you're just making sure that where we've got this, you know, this knowledge that omega-3s that you get from fish seem to really do something for our heart and our brain health, you're not going to miss out on that. But whether everyone should take them or whether we can actually get enough from cheaper foods like flax seeds and walnuts and linseeds, I don't think we're really sure. I think that's why it's, you know, if you're curious and you can afford it, take the supplement.
That's good advice. I mean, a lot of people as well, they might not think to pick up flaxseed and things like that. So I guess it's better than nothing.
But it's almost, I guess, flaxseed is almost a supplement in itself, isn't it? Because it isn't something where you think, oh, I'll have a snack, I'll have some flaxseed.
Yeah, lovely.
You have to very consciously grind it up, and it's got to be ground up because otherwise you won't be able to absorb it, and then stick it in your oats or whatever.
Yeah, except the walnut snack that I introduced you to. The walnut.
Tell the listeners.
Dried apricots and walnuts together in little stacks. They're delicious snacks, and they'll provide you with quite a lot of omega-3s.
Fab.
Are there any foods that you think everyone should be eating more of? Foods that you would really recommend people try and have every day or eat more frequently?
dive in?
I wouldn't say there's one food. I don't like the idea of, this is a superfood.
Okay.
Everyone, I think the focus really should be on diversity. So it's about getting as much of the good foods that you can, the different colours. The whole Eat the Rainbow thing, there's something to be said for that. The greens, the purples, the reds. These all actually have the sort of chemicals that our body really needs. So I think for our gut microbiome, which we're all talking a lot about now, are these really important bacteria in our gut. They thrive on diversity of plant foods. And we know that actually if we feed them really well, they will help us in many different ways in terms of our immune system and all other sort of health parameters. So I think it's a case of just having a diversity of food. What I recommend to patients nowadays is actually just pick a vegetable that you don't usually have. Just one a week in your shop. So if you don't eat a parsnip except at Christmas, get the parsnips this time. So just try and mix it up a bit. But as I mentioned before, it's fruits, vegetables, whole grains, legumes. I mean, we love beans. Maybe we should give beans a mention. Actually,
I always mention beans because it's a really cheap alternative to meat. So I'm sort of obsessed with saying to people to swap out their meat and put in some kidney beans or lentils, and then I talk about all the different types of lentils. But I think it's sort of accepting when you go plant-based that your kitchen's going to look a bit crazy. You're not going to have neat jars of 3 different things and then your spaghetti jar. You're literally going to have tens of jars of different spices, different lentils, and then your freezer is your friend because you're going to have lots of different frozen, edamame beans in there that you can grab a handful of, frozen peppers, things like that. And I think particularly where people are doing it on their own, it's important that they find ways of making it really easy to eat that diverse range of foods, which is not having a bag of salad, going limp at the back of the fridge. Your freezer is really important.
Maybe we should give tofu a mention. So the soya bean actually should probably get a mention as a soup, as a
We're
real...
not narrowing this down.
No, it's fine. It's fine.
It's really hard. There's
tofu.
so many gorgeous, delicious foods in the plant kingdom. And that's the other thing I love actually about plant-based eating. So going from being omnivorous most of my life to being a plant-based eater, I've always said this to Claire, it's that diet of abundance. It's delicious. I don't feel deprived.
No.
There's so many different things to choose from. And I'm enjoying my food a lot more than I did when I was an omnivore. But yes, to soya, I'd like to give a mention because I don't like tofu when I first went vegan, but I absolutely love it. I think if you say you don't like it, you just don't know how to cook.
I would so agree with that. Yeah.
So and it's a really healthful food for us. So it's obviously a complete protein. It's got all the 9 essential amino acids. It's really high in a lot of different micronutrients, including the omegas. It can be very high in calcium. So there's a particular brand. I'm not sure if I'm allowed to say brands on this podcast.
You can, fine.
Okay. But my preferred brand is Cauldron because it's set in calcium. So I was saying to Claire, I eat half a block for dinner, and that provides all my calcium requirements plus per day. So, it's a really excellent food. And there's been studies that show that if you do incorporate soya products regularly in your diet, you reduce your risk of all those chronic conditions we talked about earlier. Cardiovascular disease, heart disease, diabetes, and also if you swap out dairy milk to soya milk, there has been studies showing a reduction, 30% reduction in breast cancer. Wow. So it's a real superfood, and it's one that I'd say to any new vegan or plant-based eater to just experiment with, look for different new recipes, see how you can incorporate it daily. We eat at least 2 to 3 portions a day.
Yeah. I eat a lot of tofu. I have every day for lunch. I have tofu scramble on sourdough with avocado, and then I mix up the veg that I have with it. Sometimes I have a bit of spinach. Sometimes I'll do like slow roasted tomatoes and peppers, and I just have that every day. And it's kind of like a running joke in the office.
It is.
Oh, she's got the tofu scramble again. But I just love it. It's just so healthy and it's filling as well. So I think, why not?
Do you add black salt to it?
Yes.
Yeah, you've perfected it, haven't you?
Yeah.
B12 as well, nooch.
Bit of nooch. Yeah.
Can't go wrong.
That's very nice.
So for both of you, kind of with the podcast and everything else, where can we find you online, and how can we have a listen to the podcast?
Yeah, thank you for asking. So if your listeners are interested, we'd certainly say Plant-Based Health Professionals UK, our website has got a lot of information on there, including various fact sheets on different medical conditions. If you're interested in anything to do with your health and plant-based nutrition. And our podcast is called In a Nutshell. It's the Plant-Based Health Professionals podcast.
All the links are on the website, aren't they?
All the links are on the website, and we're on all the major
Episodes.
streaming platforms. So we'd be delighted if you had a listen.
So yeah, we'd like to wrap up today by asking some sort of fun questions. So Daisy, if we'll start with you, it'd be great to hear your dream vegan meal, starter, main, dessert and drink.
Oh, wow. I wasn't prepared for this one. I'm going to find this really difficult. My favourite vegan meal. Ooh, so for starter, it would have to be something with like a taco type starter. So like a little mini, either with some roasted vegetables or guacamole or spicy sauce or something like you can just pick up and eat. Mains, that's a really tricky one. Probably a tofu. God, this is, a lot of tofu, but a tofu and spinach vegetable curry type thing. So I love curries, and I think tofu goes really well in a curry. And for dessert, probably just some vegan ice cream, to be honest. Not the healthiest, but delicious with some fruit. Vegan brownie, maybe.
Nice. How about you, Claire?
Oh, same question.
Yeah.
Oh gosh. I think I would go for like a really nice, authentically done sort of kimchi pancake as a starter with a nice dipping sauce. And then as a main, I'm always going to gravitate towards crispy tofu. Something, if I see that on a menu, I've got to have that. And like slightly naughtily with some sort of noodle rather than a whole grain rice, although I should say always whole grain rice. And just some vegetables with that. That would be nice. Thank you very much. And then as a dessert, I still really like a vegan tiramisu, and there's different ways of doing it. So yeah, just a good vegan tiramisu.
Perfect. Sounds great. I think I'll be joining you. And then Daisy, will go to you again. If you could make one food product that's not vegan, take a magic wand and transform it into a vegan product, what would it be?
Do you know, I don't have an answer to that because I've found everything that I need to. There's a book actually called Everything You Do I Can Make Vegan or something. I don't know if you've seen it. I got that for Christmas actually. I think my father-in-law bought it for me. And I haven't found anything that can't be veganised. It's
brilliant.
I don't miss it. And honestly, do not miss anything from my former life.
Yeah. Nice. Is that how you feel as well, Claire? Or do you have a...
So I sort of agree, but I've had some really disappointing where I've seen a recipe for something. So one of the things that I remember really enjoying in my sort of egg continental phase was a pastel de nata and, these little like custard Portuguese tarts. And so I found a recipe online and I made it, and it was, the vegan version, and it wasn't very nice. But I know that you probably can get really good vegan ones.
There is in London. I'll
take that. I've not shared that with you before.
I know exactly where to get a great one.
Right, fixed. Just fixed it.
And finally, are there any vegans who you particularly admire, maybe like celebrities or famous people who you can think of that you admire? Daisy, we'll go to you first again.
Definitely. I mean, there's many. There are many, many. But if I had to pick one, it would be Dr. Melanie Joy, who's a vegan psychologist. And the reason I just find her so inspirational, and she really helped me actually in my transition in the early few months of going vegan, because I had a lot of guilt and I had a lot to process in my own mind about why it had taken me so long, and how to talk to family and friends. And she really, I listened to a lot of her work. I read all her books, and she really helped with that. So I think if people aren't familiar with her work, please do have a read of her books because they are amazing.
Lovely. Yeah, we're big fans of hers at Viva. How about you, Claire?
I would also say so many, because I think it's one of those things that we do. We love it when we find out that was somebody we like is vegan.
Yeah.
And one of my big thrills recently was to find out that Lee Mack was vegan.
Yes.
Because I've always really liked Not Going Out. I've always had a bit of a crush on him. And then to find that he was vegan was just, that was the whole thing. But I also really, and I know that she says that she wouldn't like to call herself vegan because she's worried about the repercussions. I really, really like Deborah Meaden as well.
Yeah.
Yeah.
Oh, fabulous. Well, thank you very much for joining us today.
Thanks for having us.
It's been an absolute pleasure.
Thank you.
We'll post all the links in the bio. And yeah, we hope you've had a nice time joining us on the Viva Vegan podcast.
Absolutely.
It's been fab. Thank you.
Thanks a lot.